TB is an infectious airborne disease. It's spread person to person. The World Health Organization names it the second leading infectious killer worldwide after COVID. Well, we're finding out more about possible outbreak. 8 News Now reporter Lauren Negretti talks with an infectious disease doctor who explains how it can infect a person.
Tuberculosis is passed through the air.
You would have to be within about 6 feet of somebody who is coughing or talking a lot to actually contract tuberculosis. And even then, it would have to be at least contact for a while. It can't be just transient, you're passing by.
UMC's medical director of infectious disease, Dr. Shadaba Assad, says it can take 4 weeks for symptoms to start.
TB cases are reported to the Department of Health, which does contact tracing. Now, Dr. Assad says you can reach out to the Department of Health or your provider to discuss exposure and treatment.
There's more concern for kids under 5.
Tuberculosis involving the lung. This is your typical patient who has a long-standing cough and fevers, night sweats, weight loss. But if you are highly immunocompromised or if you're very young, it can actually spread beyond the lungs to involve other parts of your body.
That's disseminated TB. Another severe case is CNS TB, involving the brain or spinal cord. Meningitis TB is an example. A blood test or skin test can be used to detect exposure. Phlegm is collected for active TB testing, and the specimen is stained and incubated for 8 weeks. Treatment can be antibiotics for 4 months for latent or inactive TB.
TB of any kind, active, requires a minimum of 6 months of treatment with at least 4 antibiotics to start with, no matter how mild it is.
She says severe cases may call for small amounts of steroids. Lauren Negretti, 8 News Now.
Lauren, thanks. Now, Dr. Assad says one of 4 things can happen at exposure. Either an active TB case happens or there is no infection. An inactive latent case where the bacteria enters but nothing happens is possible. And remember, at this point, it is not widespread infection, just possible exposure for parents that might be worried on this last day of school. Lastly, a latent case may become a reactivated case at a later time.